Basically, I was super athletic my whole life. Played soccer, was a skier and a tennis player and a runner. And the thought of not being active was really kind of crippling in and of itself. It all started when I sort of felt like I had a groin pull. And then eventually we got images, and sure enough, it was not a groin pull. Now, the weird thing is my parents are in their 80s. They don't have artificial hips, so it made no sense to me. So I was a bit hesitant to accept the news, but it certainly didn't get better on its own. I honestly don't remember how I found Dr. Mast, but I'm sure it was through some referrals and people talking about him. And after I met him, I immediately liked him. And his recommendation was really wait 3 months. I don't do any surgeries based on imaging. We see images that are terrible and the people feel fine. We see images that look great and the people feel terrible. So I took his advice. But a month into that 3 month period, I was downtown in San Francisco and the light turned red. I was trying to get out of the way of a car and I made it, but the light bulb went off. I realized, okay, I do not want to live like this. And I was nervous, but it really did hurt quite a bit. So I was looking forward to getting it over with and getting my life back. I can tell you, you're in good hands. He's very reassuring and calm, and obviously, the recovery process is different for everybody, but it's basically a pretty straightforward process. You've got PT that comes to the house. They give you exercises. You do them. You try not to overdo it. It really was sort of a gradual recovery, but 100% recovery. And I'm just thrilled to have both of them now out of the way. I did the other one a little over a year and a half ago. And it's great not to think about it. I feel like I have new equipment. I'm out hiking quite a bit. I do play pickleball instead of tennis. So I don't hesitate to use the equipment, but I'd like to have them last the rest of my days. The whole staff is great. There are times when you feel like you need to email somebody and ask the 15th question, and you never get the sense of like, please stop bothering us. So really think the practice is great. They're good on follow-ups. In the scheme of things, getting this done by somebody good like Dr. Mast, it's kind of one of the easier replacements you could have.